My name is Catherine Allen Bridson, and I am a nurse consultant here at the Division of Healthcare and Quality Promotion at the CDC. And today we're going to go over reporting results of point-of-care testing for COVID-19, the new National Healthcare Safety Network tool for long-term care facilities. Today we'll cover some background information related to the statutory requirements for reporting the results of point-of-care test results for COVID-19 and how NHSN plays a role in that reporting. Go over the data entry, talk briefly about the analytics currently available for point-of-care test results in NHSN, and then what will hopefully be very helpful to you, I'll provide a live demonstration of data entry in a fictional long-term care facility. Please submit any questions via the Q&A box only. As time allows, we'll answer questions from the Q&A box after the presentation. Only point of care and Secure Access Management System, or SAMS, questions can be answered today. If you do not receive an answer to your question or new questions arise after the training, please send those questions to nhsn@cdc.gov with point of care tests in the subject line. This schematic portrays the various elements of the long-term care facility COVID-19 module. The reporting pathways provide information on disease impacts on residents and staff, as well as the medical equipment and supplies needed to care for ill residents and prevent the introduction or spread of the disease within the facility. While not a pathway, the point-of-care test reporting tool is another method that LTCFs can use to characterize the burden of COVID-19 within their facility for public health authorities. This slide indicates the locations of the resources available for the POC test reporting tool. The easiest way is to access the NHSN application at www.cdc.gov/NHSN. Then click on the green LTCF COVID-19 module near the box near the top, highlighted here with the orange arrow. That will take you to the page dedicated to the LTCF COVID-19 module, and listed under data collection forms and instructions, you'll find both a data collection form, which lists the data elements collected through the process of reporting information, as well as a table of instructions, which provides information about each of the data fields and how to complete the data fields correctly. It's very important and very useful and probably underutilized. A recording of this training will also be posted on this webpage under training once it has been made ready. We're also in the process of creating frequently asked questions documents and other job aids, which will be posted as they are completed. And just as of today, these slides that I'm going to present today are posted as well under the training header. Before we go further, let's define what's meant by the term point of care testing. Surprisingly, there doesn't seem to be a standard definition. However, the College of American Pathologists defines POCT as testing that's performed near or at the site of a patient with the result leading to a possible change in the care of the patient. POCT is usually performed by non-laboratory trained individuals such as nurses, physicians, nursing assistants, and anesthesia assistants, among others. The primary advantage to POCT is the faster turnaround time for results. And an additional advantage is that these tests often require less sample volume than tests performed in the lab. So let's talk a little bit about the impetus for the new reporting tool, as well as the processes for the data sharing. The U.S. Coronavirus Aid, Relief, and Economic Security Act, better known as the CARES Act, has many portions, one of which requires the reporting of the results of every test performed to detect or diagnose a possible case of COVID-19 to the Secretary of the Department of Health and Human Services within 24 hours of results. Facilities that are performing point-of-care testing are included in these requirements. The guidance was issued originally on June 4th, 2020, but updated on October 19th. We'll discuss that in a bit. The purpose of the guidance includes communications of the data with state or local public health departments to ensure rapid initiation of case investigations by those departments. There are 4 approved ways for facilities to report the data that are provided in the guidance document, and I've included language regarding all of those reporting pathways for your information. But because our time is limited today, we're only going to cover the 4th pathway, which is the one required of CMS certified long-term care facilities. Specifically, the 4th reporting pathway is that CMS certified long-term care facilities shall submit point-of-care SARS-CoV-2 testing data, including antigen testing data, to CDC's National Healthcare Safety Network. This requirement to submit data to CDC's NHSN applies only to CMS certified long-term care facilities. Test data submitted to NHSN will be reported to appropriate state and local health departments using standard electronic laboratory messages. Other types of LTC facilities may voluntarily report testing data in NHSN for self-tracking or to fulfill state or local reporting requirements if there are any. So if there's so many possible ways for a facility to actually transmit their point of care test data, why was it so important for us to create a method by which it could flow through CDC to other users? And the bottom line is that many is not always better. Creating an NHSN tool for this purpose offers an opportunity to avoid a patchwork of different jurisdictional reporting systems by state health departments. It can share the data with HHS and CMS as well as state and local health departments, and the NHSN is already used by nearly all 15,000 plus nursing homes for other COVID-19 reporting. It's very important, if your state or local health department already has developed a process by which facilities report these data, that you contact those public health authorities before you change your reporting process. We are working very closely with state health departments that have pre-developed processes and working to streamline the processes that are in place. This is a schematic of the current data flow from the long-term care facilities. So starting on the left-hand side, the nursing home will enter the test results for each of the individuals tested, whether that be a staff person or a resident person, their resident. And from there, the data, once entered in the NHSN, will be converted into an HL7 message, which is a standard format message that will then be sent every 2 hours at least to the Association for Public Health Laboratories Informatics Messaging Services, or AIMS platform. From the AIMS platform, files will be generated and sent to the state health departments as well as to the CDC. The CDC will then in turn share de-identified information with the US Department of Health and Human Services. So let's talk a little bit about data entry. Personally identifiable information is a necessary component of a local or state public health response to an infectious disease outbreak, and therefore it needs to be collected. However, PII that is part of the testing results will not be shared directly with DHHS, as I mentioned, only with the state and local health departments. Pregnancy status, while not technically a piece of PII, is a piece of sensitive data, and accordingly, NHSN will only make pregnancy status visible to the FAC admin or those that have FAC admin rights, unless those rights are enabled to others within the facility. Additionally, groups will not be able to access staff testing data. Please note that reporting is only available to those with Level 3 security access with Secure Access Management Services, or SAMS Level 3. That is because reporting requires the reporting of PII. Level 3 reporting requires a grid card. If you do not have one, please send an email to NHSN at cdc.gov nhs.gov with the subject Enhancing Data Security. Recognizing that accessibility to the results of medical tests and other personally identifiable information for individuals employed at the facility is a sensitive issue and one that requires confidentiality, the NHSN POC test reporting tool has been designed with some safeguards in place. One of these is that only the NHSN facility administrator or others with administrative rights will be automatically granted rights to the POC data for staff persons. This means that for other individuals using NHSN for test reporting, if their FAQ ad has not granted them rights within the NHSN system to access and report staff data, they will not be able to do so. Indeed, they will only see an option to report resident data when they log in. So far, this has been probably the #2 question that we receive from users. So we'll walk through really quickly how a FAQ ad can grant and edit rights to other NHSN users within the facility. Once in the NHSN long-term care facility component, choose users from the blue navigation panel on the left. And then again, this is for a person with administrative rights. If you're adding rights to an already existing NHSN user for the facility, choose Find. Note that if you need to add someone as a user who had not previously been entered for the facility, you would do that by choosing the Add option here. From the user screen, enter the staff person's last name and choose Find. If there is more than one user with that last name, in this case Jones, you'll be provided a list of Joneses to choose from. In this case, the only NHSN user in the facility is Katrina Jones, and her listing pops up. From here, and this is the view user screen, I want to edit her information of which rights is one of the choices for editing, so I'll choose Edit. The next screen is the Edit user screen, and I want to edit her rights, so I choose that option. The Edit user rights screen allows me to choose a variety of rights that I want her to have, and in this case, she already has rights to add, edit, and delete data. I can additionally provide her with rights to staff data as well, and save. The NHSN POC reporting tool was released with a minimal viable product, meaning that we were very judicious in the fields that we required to complete the data reporting, and those were limited to those that are identified in the CARES Act and or needed by state and local health departments. It's a single page application which reduces the number of screens that you have to enter. We've pre-populated state counties that are listed so that into a drop-down menu, and other options are specific for the test device that's used. So in other words, if you're using the Sophia device, test order, the specimen source, and the test result options that you have will be specific for that device. Once you enter an individual and their test results and save that data, the demographics related to that individual are saved in the system and will auto-populate when you enter that patient ID again. It can be edited if something's changed, but this auto-populate feature can be extremely time-saving. For facility residents, the facility address is defaulted and auto-populated. Likewise, the system has been designed to allow a facility to identify default data, which will not change from patient to patient, such as the type of device used, the test that was ordered, and the ordering physician and associated contact information. A specimen number will be assigned since the results will not be assigned an accession number as tests are, which are processed through labs. However, the number can be edited if the facility has a system for assigning numbers. And finally, the data fields for whether the tested individual is symptomatic or pregnant automatically default to no, but they can be changed to yes. So how do you go about entering data? We'll go through this in a live demonstration shortly, but I wanted to include screenshots in case you wanted to go back and reference them without watching the video. You'll access the point of care test result reporting tool in much the same way you do to report your COVID-19 data. In the left blue navigation bar, choose COVID-19, and from the drop-down box, this time choose point of care test result reporting. You'll notice, as always, in NHSN, the required fields are noted with a red asterisk. If the person is a resident, choose resident from the drop-down options of the type of individual tested. Again, remember, if you've not been granted rights to staff data, resident is the only option you'll see here. You'll record the resident ID. This is a screenshot of the staff data, if you have rights to that. You'll notice that there's more information here on the staff screen than the resident screen. That's because we can't default the nursing home address for the staff person. So once it's entered once, it will be saved, but the first time it will have to be entered. Without CLIA numbers, the records cannot be sent to the AIMS as well as state health departments or DHHS. Therefore, unless the CLIA identification number has been recorded for the facility, and it only needs to be done once, the system will not allow any point of care test results to be entered. NHSN has pre-populated CLIA numbers that were provided by the CLIA representatives at CMS. But I would highly recommend that you go in and check to make sure, confirm to make sure that the CLIA number that has been entered, if there is one, because we couldn't get CLIA numbers for every facility, unfortunately, is correct. You'll access the CLIA field in order to make a change or to enter it for the first time via the facility box here on the left. Only the facility administrator, NHSN facility administrator, or those with the administrative rights can edit the CLIA field. The CLIA ID should be 10 digits, all numerals except for the third digit, which must be the letter D as in dog. We've had a large number of facilities that had incorrect ID numbers. So again, I will really suggest that you go in and confirm that that is correct. We are also building into the application a business rule which will require that that format be conformed to. All numerals except for the third, which is a D, to help to cut down on instances of incorrect CLIA numbers. This is a screenshot of the point of care test result. We'll go over this more in the demo. And this is the add physician screen. Again, we'll go over this more in the demo as well. And this is a screenshot of how you would set up a default for your point of care device. We'll talk about that more also. One question that we have received is what happens if the device that your facility is using is not listed? Currently, we have 3 devices in the application. Those 3 devices are the devices that were sent out to nursing homes by DHHS for POC testing. We are in the process right now of adding a listing of all possible point of care test devices, and that should be coming out soon, and we will communicate when that is complete. But for now, if for some reason you were to need to report something that's not for a device that's not listed, please continue to report those results as you have been doing previously. So let's just talk very briefly about analytics that are available in the point of care test reporting tool. Currently, there are 2 line list options available. One is a resident testing list, and the other is a staff, volunteer, or contractor testing option. Both of the lists can be ran in the default mode, or they can be modified. It can also be sorted in various ways. Maybe you want to sort it by the test results, so all the positives are together, or by the date of the test, and that is an option also. We anticipate that additional analysis options might be needed in the future, and as we hear from our users, we'll take that into consideration, and if needed, we'll add enhancements to the analysis section. One tip is to always remember to generate data sets before you run your analysis to ensure that all of your entered data is included. And I'll show you that in the demo as well and explain that a little bit more. Okay, so we are going to go into the demonstration. I have included here just a screenshot for you to see where to access the system. But for now, I'm going to pull up onto the screen the application. So, you know, I access the system a little bit differently than you do, but I think hopefully you all can find the NHSN landing page and then choose your facility and you choose submit. Oh goodness. Okay, it's gonna make me log in. Must have logged out time. My time must have timed out. Let's try it again. Start from the beginning. As I said, the best way to get there is to go to the NHSN website and choose NHSN reporting. I have different options than the rest of you, so don't be too concerned about that. I want to use this facility and long-term care facility, so let me submit. Keep your fingers crossed, yay. So we're going to access the point of care test reporting tool, very similarly to how you're entering your resident impact and facility capacity data. That's entered here through the daily entry, but we're going to choose POC test result reporting. And boom, you'll see that it takes you right away to the screen on which you can enter the data. You'll notice that there are two sections. One is a demographic section, and the other section is the point of care test results section. The demographic section is data that will should be static, not changing, including the resident ID or the staff ID, their name, their date of birth, and their gender. And as I said, once it's entered into the system and saved, it will be there. As long as you pull up resident with a specific ID number, you're going to get that data pre-populated. You'll notice that if I choose add test result before I put in any demographic data, I get an error saying, you know, please select the type of individual tested. So it's going to require me to enter all of this data first. We currently only have options for resident and then staff, volunteer, contractor. We are looking into the need to add a visitor option as well. We are talking with CMS regarding their requirements for reporting the results of that, and we'll make changes if necessary according to what they decide. So please stay tuned for that, and we'll let you know what happens. So let's first enter a staff result. So I'm going to put in the staff ID. In this case, I'll put in 1111, and I can click here, and this tells me that person is not, I don't have anybody in here as a staff by the name or the number of 1111. And so I can go in and create an individual staff person by that name. Let's say that this person's name is Bill. Bill is a male, just his date of birth, maybe it's December 12th, 1956. Ethnicity and race are not asterisks here you can see, but they technically are required by DHHS and by many states, and that's because of the disparities that we are seeing with COVID-19. This data should be sourced from the patient themselves. Sometimes it's difficult to do, so if you do not fill it in, it will default with unknown. As mentioned, I'm required to put in a address for a staff person. Let's say it's Youngstown, Ohio. If I go to O, it will bring it up. And then it will give me a listing of all of the counties in Ohio. I'm just putting in fictional data here, obviously, for demonstration purposes. So I have all that information. All of that will be saved. So the next time I come in and have to put in any results for this staff person 1111, that will all auto-populate. I could also, if I needed to, I could use the find results or find the resident or staff, and I'll show you that in just a second, but we're gonna go right now to test result entering. So you'll notice that many of these fields are already pre-populated, and that's because defaults have been set up. Default was set up to say that the test device to be used is the BD Veritor system. Someone in the facility set that default. And then these fields here are auto-populated with the information that is specific to that device. So the only test that can be ordered, that can be performed for the BD Veritor system is a SARS-CoV-2 antigen and respiratory specimen by rapid immunoassay. And the only specimen source that is approved for this device is the nasal swab. So that's the only option, and it automatically defaults there. Likewise, the default physician has been pre-populated. Many of nursing homes probably only have a single physician that might be ordering these, and so this is a time-saving choice that we have made for the facilities. You'll notice that we also the system entered a specimen number, and that was auto-generated, and it is incrementally assigned. So the next one would be 84312. That's again because these tests don't go through labs, so they don't get assigned a lab number. So if for some reason your facility does assign a lab number or a specimen number, you can go in and just simply edit that, type over it. No is defaulted for both symptomatic and pregnant questions. Both can be changed, and both have options yes, no, and unknown. So you'll notice that if I don't have to change any of these things, I really only have to add two pieces of information. The test date, which I can choose quickly from a drop-down box. It's going to either be yesterday or today, since these should be reported within 24 hours. And then the test result, detected, not detected, or invalid. And again, these will change depending on what test device is being used. These are what the readings that you will get on the machine. So the possible readings. So let's just say this is positive, and I'm going to save. And that is it. This result has been recorded. You do not get a confirmation message per se. Instead, what you get is you get this option to say, I'm done, start a new POC test result report. And then when you say that, it asks you to confirm that you want to clear the current screen and allow entry of data for a new individual. And are you sure you want to continue? And I say, yep, okay, or no. And then you'll get this, that you're going to leave this page. And then it takes me right back to where I can enter a new result. Let me show you that. Let's look at a resident entry at this point. I could go in and say, I want to find Mr. Smith's result. And I type in Smith, and it returns all of the Smiths that are in the, were recorded in the system. This is the only resident with last name of Smith. I can choose that individual, and it pre-populates all of the demographic information, as well as this person actually had a test result already in here from 10/29. They had a positive result. I could go in and add results here, which would, you know, be very quick, because all I have to do if I haven't changed any of these is to simply go in and say, oh, now I did another one. It was on today, November 5th. These haven't changed. This time it was not detected, and I'm going to save that. They're not symptomatic and they're not pregnant, so boom. I've saved it, and now there are 2 results here. Let's look quickly at how you can change the default or set the default. If you'll see here, you have an option for choose default for the device. And in here are the listing of the 3 devices that are available: the Binax Now COVID-19 antigen card, the Sophia SARS antigen FIA from Quidel Corporation, and the BD Veritor system. Right now we have listed the BD Veritor system, but if I wanted to assign a different, let's say I wanted to choose the Sophia, we got Sophia devices in, and I just choose that, and I set save as default. You see it's now here. Anytime I go in, if I don't change it, that will be the default. You'll notice that the specimen source here is not auto-populated, and that's because Sophia actually has 2 sources that you can use, either a nasopharyngeal swab or a nasal swab. So you would have to choose what you've actually done, nasopharyngeal being the really deep specimen collection. And then likewise, physicians are saved as default. If I want to add a physician, I can add one here. Let's say it's Christine Phillips. She lives at 29 Main. She is now listed here. She's not yet the default physician, but if I want her to be, I click on her and I choose save default as default, and you'll see that she is now listed as the default physician. It's requiring me to put in a result here, so we'll go ahead and go in for yesterday. Okay. Let's go ahead and look at, put in a new one. Put in a resident. Your resident ID, your ID for your resident is going to be whatever number your facility happens to use for your residents, to identify your residents. It should be consistent, meaning that if the patient, or I'm sorry, the resident was to leave to go maybe to the hospital and then come back, the same number would be used. You may have to create, you would probably have to create staff ID numbers. Whatever you want to use is fine as long as it's consistent for every event for that person. So let's put in 1111. I click here and boom, you can see that this person is already in here. So I don't have to fill in any of this, and I have her test results here. If I wanted to go back and put in someone who's new, who's not been in the system before, they're not here, and now I can directly enter the resident from the screen. Maybe it says I'm the good female. Just making something up. Hispanic. And then I would just go and enter my results. And again, if I don't have anything that's changed, boom, I just put in, this was a nasal swab. It was detected. Okay, let's say they were symptomatic. They weren't pregnant. Safe. And that is it. So hopefully you can see that it can go very quickly once you get individuals entered into the system. Let's look at analysis options very quickly. I talked about generating data sets, and I said I wanted to provide you a little bit more information about that. What generating data sets does is that it basically goes in and grabs all of the data that's been entered since the last time that data sets were generated. So that means that in this case, the last time data sets were generated was November 2nd at 1:06 p.m. Any data that was entered between November 2nd at 1:06 and now, because data sets haven't been regenerated, is not included. It's in the system. If you go in and look for it, it will be there, but it won't show up in your analysis. So always generate data reporting data sets to get all of your information. There are some rare instances when you may not want to generate a data set, you know, but for most of you, you're going to want to do this each time you go ahead and run analysis. And so it's just running through the processes of checking all of the various areas within the system to get the most up-to-date data. While we're waiting for that, just wanted to let you know that you can enter data retroactively as far back as January 1st, 2020. It is not a requirement, but some states are asking their facilities to do so. So you would need to check with your states to find out if they indeed want you to do that. So I'm almost done here. It told me that it successfully generated them. So I say, okay, go back to my analysis. And now I go to reports and I'll get a tree of options here, depending on what I am reporting in NHSN. You can see my HAA module. So my urinary tract events, this is where I would generate reports from that. But in this case, I'm interested in COVID-19, and I'm specifically interested in point of care testing. As you can see, I have an option for a long-term care resident COVID-19 testing. And because I have access to staff data, I've been granted those rights, I have an option for long-term care COVID-19 line list. We won't get into custom reports for today just because we don't have a lot of time, but I can choose the resident line list. I can just choose to run the report. You see, I also have modify and export, but if I just run the report, I will get the default. It was on my other screen, so I had to pull it up. This is the default output. You see, these are the default variables that are included. And the staff will look the same. Going back just to this, just to show you, I can modify the report. I can choose different variables. These are the variables that are already selected and are showing, but I can also add any of these that are listed here. Maybe I want to include the specimen collection date. I choose this selected and move this over in this arrow. You see it's now here. Now when I run, I'll get that. I could also save this if it's something that I want to do. I don't want to have to choose it every time. I'm going to use it every time, but I want to choose it every time. I can save this report and name it, but we'll just run it for now. And just to show you that specimen collection date has been added here on the end. Likewise, you can sort your variables if you do not want to, if you want to if you want to have it sorted by, for instance, maybe the result, test result, I could choose this and move this over to the side and run it, and it will, it should, actually, I think I have to move this up. Move this up to here, test result, run. Yes, got this right finally. Now you'll see that it's sorted by test results, all the negatives together and all the positives together. Very briefly, I want to show you how to check the CLIA number. That is here under facility info. Here is your CLIA number. This label is going to be changing from CLIA number / CLIA waiver number to read instead CLIA identification number. We've been told by our CLIA partners that that is the accurate term. And this is where a person with administrative rights can go in and change this. If this was off, maybe one, I could change that. And if there was a typo, and then just choose update. Now it's 88 instead of 89. So I'm going to let's just really quickly summarize what we learned today, and then we can see if there are any questions. The NHSN point of care test reporting tool for COVID-19 has been identified by the Department of Health and Human Services as the method by which the data should be reported. The tool enables the facilities to report the data, which is then shared with state health departments and also with the CDC and USDHHS. For the few state health departments that already have implemented reporting pathways for the data, we are working with them very closely to identify messaging as well as some potential solutions to avoid double reporting. Data entry in the system has been built to be minimally burdensome. Currently, there is only a manual data entry. A possibility of a CSV file upload is being considered. We hear facilities that would like that option. We do expect future enhancements. And if you have questions about the system, please email nhsn@cdc.gov and include in the subject line something along the lines of POC test reporting tool or POC or something like that. And so now we're going to open it up for questions that were submitted via the Q&A option.